Hello, everybody, and welcome. So happy to have you here today. And I am going to click the go live button on. All right, I think we're live on Insta as well. Woohoo!
Hello.
always, always have to celebrate when things work out as one would hope. All right, guys, happy Thursday. And boy, oh boy, have I got a special treat in store for you today. Oh, this has been so long in the making. So I am super excited. I want to welcome everyone to the Live with Lesli. And I am Lesli Vitale, and I'm just so delighted to have you here with me today. So here's the deal, guys. If you are an integrative practitioner and find yourself often suspecting mycotoxins as the root cause of your patient's sometimes very strange symptoms, like seemingly unrelated symptoms, you, my friend, are in the right place because we are going to take a deep dive into this topic today. And we are going to be talking with my wonderful client, Katie Driessens. You know what? I might have mispronounced that.
You're so close. Driessens, but I respond to everything.
I know. As I look at it, I'm like, you know what? I think, yeah, Katie Driessens from Dietetics with Driessens LLC. And so today we are going to jump into a topic entitled, Are mycotoxins one of the upstream root causes of your patient's downstream signs and symptoms and various abnormalities? So again, you do not want to miss this conversation. We got a lot to dish on, don't we, Katie?
Oh, yes. We're going to spill all the tea.
Yes. Both Katie and I are, I guess, let's say reluctant experts in this area. It's one way to put it. We did not sign up to become experts, but life threw that at us, and here we are. So again, for those of you that are joining, big warm welcome. I'm so happy to have you. I'm Lesli Vitale, and I'm a practice growth expert and mentor specifically for integrative and functional health practitioners. And I help my clients to attract more right fit clients. I help them to grow a profitable practice while integrating multiple streams of revenue into their business model. So with that being said, I want to welcome everyone, especially Katie. And really happy to have you. Now, Katie and I are almost neighbors, right?
Yeah.
Katie's in Illinois, Naperville, and I was in Chicago for many, 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 many years and just moved across the border to Lake Geneva. So I would say we still count as, let's just say, pretty close neighbors, right?
Because you're just above the border, right? Like the Lake Geneva area. So gorgeous up there.
Yeah, barely across the border. Yeah, it's really pretty here. Lots of, beautiful wildlife. Winter, not so great, but in all honesty, not so different from what you have. So it's pretty much all the same. So anyway, Katie, what I'd love to do is kick off our conversation with a little bit about you. I would love for you to just kind of share with our audience, how did you get where you are? I had kind of alluded to how, in both of our cases, we were kind of unwilling. I don't know if that's the word. You just got to kind of jump in and accept what life throws out your way. And I know that was absolutely the case for you. So give us a little background on yourself.
So like Lesli, I've been a dietitian for quite a while. 13 years. And I, like most of us, traditional Western medicine trained, still very much believe time and place for Western medicine. But in my own personal life, things were not starting to add up. And all the, common tricks, I guess you could say, of, going to Western medicine, but not really getting better, still not feeling myself. Eventually, I stumbled into functional medicine and was getting better. And that really opened my eyes because I will be completely honest, was in the beginning thought that was quackery. Functional integrative medicine is just, all sorts of wrong beliefs, to be completely honest. And when it got personal,
it's really how we're trained. It's really bizarre kind of looking back, just that mindset. So I do actually I have a little bit of empathy for people, for practitioners that aren't on board yet, right?
Yes.
Because I know I used to be one of those people, like so skeptical, right? Like it's just so fascinating looking back.
Mm-hmm.
So yeah.
We're so conventionally trained, and there's a time and place for all that. As you can see from my title, I'm a board certified diabetes educator. I was in endocrinology for many, many years. I worked in pharmaceuticals for 4 years. So I do think there is a time and place for that. But I think sometimes if people don't perfectly fit into a ICD-10 code box, it's come back when you're sicker. And
Yeah.
no one was taking care of me. And when we finally figured out that ding, 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 mold was behind a lot of my own health struggles and my son's very severe life-threatening struggles, did it really occur to me that, wow, this is the path we need to go down, because that's what really got me personally better and my son. And then here we are several years later, I have a whole business around functional and integrative nutrition with an emphasis on helping people who are mycotoxin impacted. So that's the very, very short and sweet of how I'm here. Like you said, I didn't necessarily want to be here, but it is the path that I am down. And now I will say I have a lot of purpose in what I do. I feel so called to help people who were in or I'm still kind of in their shoes, but I was in your shoes. So I have a lot of purpose now.
Yeah. And you, especially because it involved your child, right? Like, it just, I mean, I have to say, in my personal experience, my son also was symptomatic. However, it was not life-threatening, right? It was irritating and frustrating, but it definitely, as far as I know, was not life-threatening. So that when your child is in that situation, it absolutely amplifies, I mean, a millionfold. Google, right? Like an infinite amount of stress and anxiety, right? And plus, you're dealing with your own symptoms simultaneously, trying to make good decisions. And we all know when you are exposed to these mycotoxins, and if you're sensitive, just clear thinking can be a real problem.
Brain fog is a very common symptom. That is correct. All sorts of things, just like the title of this presentation. It can show up as so many different things, right? High cholesterol, depression, anxiety, ADHD, yeast infections, respiratory, unintentional weight gain, leptin resistance, you name it, right? We breathe it in, gets into our lungs, gets into our circulatory system. It can cross the blood-brain barrier. So wherever it can go and impact. And that's why I hear so often from patients, they're like, gosh, but like this person had this symptom and I have this symptom and this person has this symptom. It is very dependent upon our own bodily constitution as to how it shows up. And so I think that's such a reason why so many people downplay it or discredit it, because it's not like one very characteristic presentation. So yeah, I could go off and on.
Yeah.
This whole topic, but
I love it. So, okay. So you have your own experience with your own health as well as life-threatening symptoms with your son. Would you be willing and comfortable to elaborate on that a bit?
Absolutely. I told myself I was not going to get emotional on air. It was I was telling you this earlier, I'm going to try not to, at least 2 years ago this week, my son was in, here we go, respiratory failure in the ICU. And now he is perfectly healthy, doing really well. So we moved into a new house. I mean, new to us. It was an older home.
Yeah.
And we were fine. He was little, just a year old. My daughter was 5 or 6. I was in my early 30s, and we subtly started getting sick. And a lot of people who get mold sick, it takes a few months. A lot of the big wigs in this profession, Dr. Krista, Dr. Shoemaker, Nathan Neal, a lot of them agree it takes a good 3 to 6 months. It's not like you just walk into a home and you get sick. Now, some people can if they have an IgE-mediated allergic response to mold, but there's a big difference, and I can elaborate on that later if you want me to.
I do.
Allergenic responses versus toxic responses. And mold usually is more responsible for the toxic part, but I will use this analogy a lot. Mold is the gun, mycotoxins are the bullet. It's usually the bullet that's really harming us, and especially when it gets into our body. systemically and shows up, like I said, wherever it decides to show up, it can make a person very sick. And then you layer in genetics. There's certain genetics that can cause the mycotoxin to not be very well taken out of the body. And so going back to my son, I was starting to have some subtle symptoms. My son, respiratory distress every month, multiple times a month. I questioned mold because I, as a functional medicine aligned person, thought, gosh, this looks like mold toxicity. I know 30% of all asthma cases are not asthma, it's mold toxicity. However, we had a few poor home inspections. And so I didn't know at that time a lot about home inspections. I just took those people's word face value that, yeah, you don't have a mold problem. But it wasn't until, like I said, 2 years ago this week, my son was in the ICU in respiratory failure. That I took a sledgehammer to a wall in a fit of rage, as a lot of us are eventually, because we've been so gaslit for so long. Oh, mold's not your problem. Mold's not your problem, until you really connect the dots and find out, oh my gosh, it is the problem. So once we figure that out, I had a third or fourth opinion. So another inspector come out and we found out, oh my gosh, very substantial infestation in our attic, in our crawl space. And it required actually several big home projects to fix the root cause, kind of like in healthcare, we talk about root cause medicine. Same with the house. I mean, mold just doesn't happen. It's usually poor ventilation, humidity issues, a leak pipe. And it's usually nothing like out in the open. Most people will be like, and that was one of my reels on Instagram today, smelling it and seeing it are not valid inspection methods. Most mold in homes is very hidden. So most people are surprised, like, well, how did you not know? It's usually very hidden. So once we found it, took radical action to get rid of the problem. And to this day, my son is off all of his inhalers. He's thriving. He's going to be going to kindergarten. He's great. A lot of my health issues have subsided. I ended up being diagnosed with CIRS, chronic inflammatory response syndrome, but I am, and all my family members, leaps and bounds better than where we were a couple of years ago. So I'm obviously very passionate and personally invested in helping people through this hell, to be perfectly honest, this hell.
It's living hell. I don't think there's any other good word for it. It is the most confusing, not to mention expensive thing ever. And meanwhile, you barely can get out of bed, right? Your ability to think clearly is, well, again, depending on the person, but that is a really common symptom. You're just really not able to think super clearly. And it's hard to make these big decisions. And frankly, it's scary because, I would just say for many people, the cost, like once you find the mold, like I would say finding it is, I don't know, maybe half the battle. Wouldn't you agree?
Yeah.
It's like, because it is hidden. And one misnomer that I just want to put right out there is the idea that, oh, I live in a dry climate, there's not mold. Hello.
I have patients all over the country, Arizona, Texas, Colorado, does not matter the climate. Illinois, I have lots of patients here in Naperville, Illinois. It does not matter where you're at. It's the building that makes the difference. The functionality of the home or the school or wherever it's at that really trickles down into if there's going to be a mold or mycotoxin problem.
Now, for our audience, help us to understand when you say mycotoxin, what is that exactly?
Great question. So I'll go back to that analogy of mold is the gun, mycotoxin is the bullet. And it is essentially a poisonous metabolite that comes from the mold spore itself. And it can cause a lot of acute and chronic issues. And I do want to come out and say, well, I know, I shared a little bit about my son's life-threatening issues. I will say in the hundreds of patients I work with, most people don't have life-threatening issues. So if you're sitting watching and you're like, well, gosh, I'm not in respiratory failure, I can't have a problem, that is far from true. Most people, it's much more subtle or chronic issues, like you were saying, Leslie, brain fog. It's neurotoxic, the mycotoxin specifically. And I'm going to also take a step back. So mold spores, the actual spore, Western medicine does recognize those as being problematic, leading to aspergillosis. They do acknowledge that it can cause asthma, pneumonia, and then there's one other I'm not thinking off the top of my head, but they really kind of limit it to this part of the body. Oh, there's my cat over there. Say hello.
Hello.
And then the mycotoxins. So some people will joke the fart of the mold spore. So the secondary metabolite.
Yeah.
It's a good way to think of it, right?
Yeah.
The metabolite that it produces that is poisonous, we breathe it in through our nasal passageway. Like I said, it gets in the lungs, and then from there into the circulatory system. And now it's the brain, and it's the liver, and it's the kidney, and it's, you name it, it can go wherever blood can go. And it's, like I said, neurotoxic, hepatotoxic, carcinogenic, infertility, GI. I'm a gut health practitioner too. I see a ton of SIBO, oftentimes from mold because it's immunosuppressive. So I guess to answer your question, Leslie, before I go way off on a tangent, is it's this poisonous little metabolite that comes from mold that can do tons of damage in the body. And to the whole point of the title of what we're here talking about, it is often Western medicine will capture the downstream symptom of, oh, you have depression, or oh, you have anxiety, or oh, you have fatty liver, or oh, you have high cholesterol. And not saying those things aren't real. They are. They are real. People deserve care and treatment. But where is it coming from? Western medicine loves to say, oh, it's genetics. It's genetics. It's genetics. It's genetics. Okay, really? Genetics load the gun, but the environment pulls the trigger, right? There are reasons why the body starts to act out. I'm so into epigenetics, but so yeah, that's, we really need to be doing our patients much more thorough care and asking questions. And that's why I love functional integrative medicine so much, is it asks why, not just the labeling it, the what, what's the ICD-10 code assigned to pharmaceutical. Why is the body acting out? The body's never wrong. It's smart. It's alerting us to symptoms. Check engine lights are going off. Do you have a good enough mechanic to figure out where that check engine light is coming from?
Absolutely. So my takeaway, lots of takeaways, but one of the big ones that I think is worthy of repeating is that the manifestation of this problem is extremely varied, right? And that is probably one of the things that makes it very challenging. And some people can walk into a building and they instantly know, like they get a migraine or they have some kind of a symptom that just tips them off immediately. I was not one of those people. Mine was kind of like the low level, or I don't know, maybe it was probably high level eventually, but it was just a lot of like insidious, seemingly unrelated symptoms that made no sense. Right?
Yes. That's what I see in my patients all the time.
Yeah. And I know I can speak for me as well as my son. Probably the most burdensome and troublesome symptom was just this feeling like I was always coming down with something, right? Like I was always getting sick. And I mean like to the tune of a couple times a week, right? Good news is for me and my son, like we never, I shouldn't say never, but very rarely ever really, really got sick. But it was like this chronic low level, how you feel yucky when you're getting sick? So that was like a regular thing, right?
A lot of patients describe it as feeling heavy. When my patients tell me they feel heavy, they feel bogged down, they feel like they can't think straight. And oftentimes it will get labeled as depression. And again, I'm not saying depression, anxiety aren't real. Those absolutely deserve care and treatment and acknowledging those symptoms that can very much impact our life. But is it always, a neurochemical issue? Is it a toxigenic problem? I think we should throw that out there. And there are objective ways we can look into that more.
Yeah. So let's check in with our audience. I'd love to hear from you guys. Are you suspicious of certain people in your practice? Are you thinking that their symptoms could be related to mycotoxins and or mold? Give us a little feedback. Would love to hear from you. All right. So it's very complex. How do we definitively diagnose what is now known to be CIRS? Chronic inflammatory response syndrome is an actual diagnosis now, right? And do doctors is that a diagnosis that they are leaning into? or is it still kind of on the fringe?
Great question. So a couple things I want to talk about. My role as a dietitian with mold, and then also the actual medical physician diagnosis. So medical diagnosis, doctors that are, I would say, mold literate, that do recognize and understand what mold is, which I will say very much pioneered by the research by Dr. Richie Shoemaker, which you and I have talked a lot about. There's a lot of other mold literate practitioners out there. Dr. Jill Christa is a great one to follow, Nathan Neal, John Whitcomb. I could name drop a whole bunch of people all day, but there's a SIRS website you can go to and read about all these physicians and their bios and all the research they've been doing. So chronic inflammatory response syndrome, it takes several things to be diagnosed. Exposure to a water damaged building, which is, let's be honest, 85% of us is what the medical community agrees on. There's tons and tons and tons of studies, and even, government funded agencies, CDC, World Health Organization. A lot of the numbers are between 50 to 80% of all homes have water damage to them. So we're not talking about small numbers here. We are talking about the majority of homes. Now, that doesn't mean because your home has water damage that you are going to go on and get SIRS or get as sick as me and my son. There's so much nuance in how good's your immune system? Do you have other comorbidities? How well does your liver detox? What's your nutritional status? I mean, there's so many things and all these nuances I go over with patients. But to get that diagnosis of SIRS, 1, water damaged building, 2, a gene, the HLA-DR, I believe it's like gene 1, 2, 3, 4, 5, if you have one of those. And then there are certain biomarkers we can look at, like, let's see, TG beta 1, some really obscure blood work, a C4A. I had a really high C4A, which is an inflammatory marker. I had no antidiuretic hormone whatsoever. So a lot of our mold sick patients feel extremely thirsty. I still have some of that lingering today where there's always a drink by me. We're still working on getting that better because it can take years to get better.
Literally, I think that one, I've consulted with docs on that, and they're like, that one's really, really tough to rectify. Right?
And so oftentimes they'll check blood sugar and they'll be like, oh, is this, because I'm a diabetes educator, is it diabetes? They're really thirsty. And all this stuff will come back negative. And then they'll just be like, oh, you're thirsty for no reason. Check the antidiuretic hormone. I had 0. That's another one. So anyways, water damage building, positive gene, or positive for a few genes, or one of them. And then there are certain biomarkers that can be looked at. And then a lot of SIRS doctors will check those as time goes on. First rule of toxicology, get the patient out. And then there is a whole biotoxin pathway that explains what chronic inflammatory response is and what the cascade is in the body. And then there is a whole slew of treatment options. And it really depends on, well, how is it impacting the person? What other comorbidities do they have, et cetera? So that's, I would say, SIRS, how it's diagnosed and essentially handled in the mold community and the practitioners that recognize and are literate with that diagnosis. As a dietitian over here, obviously, I'm sure there's a lot of dietitians watching. I don't, I'm not practicing medicine. I'm not making medical diagnoses, but we can look at biomarkers and provide medical nutrition therapy. And that is what I do. I don't do SIRS blood work, but I will order lots of tests that we're legally allowed to order, especially within Rupa Health. Things like urine mycotoxin testing. I do serum mycotoxin antibody testing. And then, of course, I will look at the downstream effects from mold. And it's often like people aren't always coming to me, and some are like saying, hey, I think I have a mold problem. But oftentimes I'm working with a patient, they have SIBO and it keeps coming back, or they have migraines that the doctor can't figure out. And so I'm, screening for nutrient deficiencies and correcting. I'm doing GI map testing and fixing. I'm doing all this stuff. But then sometimes they'll say something like, I feel so heavy, or my 25-year-old son has asthma now out of nowhere. Or there's something that they'll say that I'm like, have you checked your house for mold? We'll do urine mycotoxin testing and or serum mycotoxin antibody testing. Ding, ding, ding. I get 10 to 20 positive tests a week in my patients.
Wow.
It is not a small problem, folks. It is a huge problem in this country. It's just, like I said in my bio, drastically under-discussed.
Okay. Wow. That is a ton. It's frightening.
Probably, close to 100 patients a month.
Oh my God. Okay. And that just the suffering is, just beyond comprehension. Okay. So you start to suspect, you do these tests, right? Which adds validity to your suspicion, right? And then what do we do?
Great question. So I will use the analogy often of your body is a bathtub. I can help drain the tub, right? So we can do ways to do medical nutrition therapy to help reduce oxidative stress. I can do things like binders. We can increase um, nutrient deficiencies or correct those I meant to say. I can help upregulate metabolic detoxification, which, side note, one huge thorn in my side is when you'll hear this reductive and dismissive phrase, if you have a liver and kidney, you're detoxing. I can't stand when dietitians or healthcare professionals say that. I understand where it comes from, though, because I had that shoved down my throat when I was in school. But there's more to owning organs than detoxing. We need more than owning organs to detox well. We need open drainage pathways. We need nutrient deficiencies corrected. And our liver does, it's not a superhero. It is, we're mortals. It does have a toxin processing capacity. When it reaches that, a lot of stuff gets diverted to fat cells or systemic inflammation. And hence, we can start to get really sick, like from mold. So, gosh, I'm going down a rabbit hole.
That's okay.
But anyways, so those are things we can do. We can upregulate metabolic detoxification, correct deficiencies, medical nutrition therapy, binders. And then, of course, I'm always saying, I can't be doctor here. Work with your physician for medical evaluation and management, because sometimes there are other things that need to be done.
Mm-hmm.
The problem is there's so few mold literate doctors. People are desperate. They're looking for anyone who can hear them, understand them, and at least give them some care and help point them in the right direction. So back to that analogy of they're a bathtub, I say, let's drain the tub. And then I have a whole course and resources that I will share with them if they're, wanting to do a course on ways to shut off the faucet, right? Okay. So, because some people then are, gosh, what do I do? Who do I call? Who do I trust? And so I'm not a mold inspector, but I can share with you a lot of credible information on hiring a mold inspector and that whole other world of getting out. Because like I said earlier, first rule of toxicology, you're never truly going to get better. Everything else is going to be a Band-Aid. And as you know, Leslie, you've been there.
Mm-hmm. Yeah, and I do think that's a really important, I don't know, almost like a myth, perhaps, in some cases, to dispel, right? Because, you feel so desperate. And I think when you're going through this, you're extremely vulnerable, right? Mm-hmm. And the reality is, you're not going to get better until you get out of the moldy environment. End of story. Yep. I swear I was ready to sleep in a tent.
Yes. I was scared to be in the house.
Yeah. Mm-hmm. I was like, I will sleep in a tent. I'm okay with that at this point, because again, like I do want to circle back to like the inspection process. That was honestly one of the most challenging parts of this. You buy a home, you get a home inspection. Yay, beautiful home. Everything's great. But you move in and something's not right. And
mold is not part of a home inspection for all those watching.
Yes.
You are not. As we said earlier, 85% of all homes have mold or water damage. That what equals mold is organic material plus moisture or water equals mold within 24 hours. So all homes, or I shouldn't say all, the majority of homes have some, but it's never showing up on a home inspection unless you're going above and beyond and actually hiring a mold inspector, which is not common as part of a standard home sale. So people always think, well, it would have shown up on my home inspection. Mm-mm. It does not.
In our home, they didn't even look in one of the attics, Mm-hmm. It was just very serendipitous how we opened that and we're like, oh my God, and the other thing I just want to mention is sometimes, and I don't know if this is improved with home building standards, but there was a time when homes were, let's just say like the ventilation was hooked up incorrectly. Like I'll give you an example. In one of our homes, I want maybe even a couple, like this was super, super common. The ventilation from the master bathroom was going in the attic. Okay.
2 patients this week with that story.
Mm-hmm. So that is a really good place to look. Another home, Oh, I know. I think, I don't think I'm making this up. This was a while ago. The steam, I think, from the dryer was going like in the attic, I think, something like that. Some really weird, random thing.
I've got 10 patients I can think of off the top of my head where that's also been the case. The
Yeah.
other one I see all the time is a poorly breathing attic, not enough soffits, not enough air blowing out, basements, crawl spaces not being encapsulated. Those are notorious areas as well. I don't want to sound all doom and gloom. There are answers. There are ways to fix all this. We can get the home safe. It's just like you said, Leslie, it is the Wild West out there when it comes to home inspection. And so it really takes learning about this stuff.
Yeah.
I will never get a moldy home again because of how much knowledge I've accumulated over the last few years and all the evidence and all of the groups I'm a part of now and aware of, like the Environmental Society for Environmentally Acquired Illnesses. I mean, there's so many groups out there and organizations that talk about this. It's just, I feel like if you're not in the mold world, you're completely oblivious because you've never had to think about it.
Yeah.
Once the dots connect, it's like, wow, your world is completely just rocked, I guess you could say.
Completely. Yeah. So, hey, Rukshana is here. Great to have you. And yes, it sounds like you are suspecting mold toxicity in your GI patients, especially the ones that have recurrent GI issues, which, yeah, that makes a ton of sense. And I think, Katie, I think you had alluded to that as well.
IBS. I mean, I'm not saying IBS isn't real. It is, but studies show 50 to 80% of all cases are a pathogenic overgrowth. And oftentimes, if the pathogen keeps coming back, why? What is suppressing the immune system to cause the candida or the SIBO, the bacterial overgrowth? There's usually a reason, and a lot of times it is mold. So totally agree with you there. Good for you for connecting those dots and knowing that and advocating for your patients.
So what about this question? Is sudden onset of fatigue another symptom?
I would say it's worth looking into, right?
Yeah, I really would. And the irony is, I mean, mold, mycotoxins, mold, this whole scenario can, I mean, I would say, like, if you look at the chart, like Dr. Shoemaker has a really cool chart. Guys, if you go to survivingmold.com, that was the resource that I really used to help me through this. In fact, I consulted with Dr. Shoemaker as well as one of his trained providers. So I felt really confident that I was getting really the best possible care with somebody, a couple of docs who had tons of experience. But what you'll see is that it impacts every body system, everything. It's crazy. Mm-hmm. Hormones, your ability to sleep, right? You can't sleep, but yet you're tired. It's just the craziest thing.
That biotoxin pathway, I think, is what you're referring to. And oftentimes you'll see women will come to me and they'll schedule, and the main issue will be like hormones is what they'll put in the scheduling comment. And hormones are a messenger of something deeper. I mean, specifically in the reproductive years, obviously menopausal years, par for course, those will downregulate, but reproductive years, low estrogen, low testosterone, low progesterone. Why is it conserving energy and wanting to downregulate that and not feel safe for conception? Mold is often at the root of that. So totally agree with you. I didn't mean to cut you off, Leslie. The biotoxin pathway is a great resource and a really good visual. I've got it in my course. It's in my blogs to show that and highlight how that was actually one of my symptoms. I was, early 30-year-old woman with like no progesterone. Why was that? So there's got to be a reason. And in my case, it was mold.
Yeah, I'm going to share that website. Did I spell it right? Survivingmold.com. Okay. Yeah. For our practitioners and really anyone that's joining us today, survivingmold.com really was a wealth of welcome. I remember just devouring it, right? When I first got that diagnosis. Oh my gosh. Because I just couldn't believe like someone finally got it, right? It is a eureka moment. Then the work starts. But like Katie said, guys, there really is hope. And I think Katie and I are prime examples of hope, right? We both really struggled. And it definitely is not an overnight fix, that's for sure. And I think both of us could attest to every time we thought we cracked the code, like, okay, eureka, we found the source in the house. Yeah, unfortunately, it wasn't always the end, right?
Yeah, things come in pairs. There's often more than one issue.
Yes. So do remember that, because that was definitely the case for us. And interestingly, I remember, so we had the attic, we had the basement, some issues there. And then we thought, yay, we're good, bring on the healing. And then that didn't happen. We're like, oh my God, what else could it be? And we figured out, believe it or not, like, those foam rubber like handles on exercise equipment in the basement, I guess there was a lot of mold growing on those in our basement. Who would have thunk, right? And then the last thing was we had a very old Sub-Zero refrigerator built in. And I was like, it's just the last thing I can think of, because I remember looking at the floor going, that's weird. There's water on the floor, right? And I was like, okay, and you kind of hate to, pull that thing out and replay. I mean, there are a lot, right? But I was like, I don't know if it's going to do it, but let's just do it. And lo and behold, that was kind of the last element that needed to be rectified in the house. So guys, anywhere that there's water running, even places where water doesn't belong, like you said, you took a sledgehammer to your walls, right? And it's behind the walls. It is not like just, it'd be so easy if it was just, right in front of your face, right? Sometimes, you get lucky and you can actually see it, but a lot of times it's just, it does require some detective work. So yeah, go ahead.
Oh, I was just gonna say, those are probably two of the biggest myths I hear from patients, when a lot of times people will get in what I call mold denial in the beginning because they don't want to believe it. Yeah. And I agree, it is a hard pill to swallow. It took me a little while to really believe, or even to want to acknowledge it, because that's part of a grieving process for people, right? That denial that sets in. But two of the biggest things that people misperceive all the time is that only black mold makes us sick. So if they see like a little white or a little green, oh, it's not black mold. And then the other thing is, oh, it's just a little mold, 1 square
inch.
Or mildew. Mildew is mold. It is mold. 1 square inch of mold puts off over 1 million spores per day. Multiply that by, like with you and I, Leslie, it was both our crawl spaces and our attics. Every joist covered. I mean, we were breathing in trillions and trillions of spores a day. No wonder. And not saying all houses are like that, but sometimes people will be like, oh, it's just a little mold. But mold's not my problem, but I'm still going to struggle with migraines. I'm still going to keep gaining weight unintentionally. I'm still going to you have to, when that moment hits that I'm never going to really get better, I'm going to have all these Band-Aid solutions. The chains are like released and you're like, oh my gosh, I can live a life of not feeling like garbage every day if I just correct the mold and detox my body. So much power in that.
Yeah. And really, it kind of actually gives me the chills. I'm having a kind of I don't know, like a visceral sort of reaction. Ooh, hair standing on end here, guys. Because it is really true. Like it does. I don't want to sound like Katie said, doom and gloom. It is a really, really tough thing to go through, but there is truly light on the other side. Absolutely. And I will say for me, this is me and actually my son, just getting out of the moldy environment, we went back to normal. Now it is true, I did do the Shoemaker protocol, but if I'm being honest, I probably, like the big thing for me was just getting out. I had that nasal, what do they call that? The Marcons infection. Yeah, really, really, I had no idea, no clue whatsoever. So there are some kind of stealth infections that sometimes are associated with chronic inflammatory response syndrome. I'd say pretty easy to treat, but you have to get it tested, right?
Yep, that really crazy statistic that even by Mayo Clinic, so even Western medicine acknowledges this, 96% of all reoccurring sinus infections is mold toxicity. So if you are someone that is seeing, or you personally are seeing a patient with reoccurring sinus infection, they almost with 100% certainty have mold in their home.
Yeah, I didn't. I never had a sinus infection, which was so strange. So not one that I knew of, right? So, and you'd also mentioned asthma. So talk to us about asthma as well, because that is a super common issue, especially with kiddos, right? So tell us about that.
If there is new onset symptoms and it seems kind of out of the blue, I would definitely question mold. Not saying asthma doesn't happen or that, COPD is not real. There are lung issues that are not related to mold. However, experts agree that 20 to 30% of all asthma cases is mold toxicity. The lungs are inflamed, which is often what's happening with asthma. But why? Like I said, there can be other root causes, but a lot of the times it's an environmental toxin. That's a huge percentage of cases. And so with especially little kiddos, right, when you see reoccurring cases of bronchiolitis, which was what my son was happening to him, we were going to the ER and he was seeing 8 different doctors at one point. And we were so gaslit. No, Katie, you're crazy. It's not mold. And I can't even tell you like the frustration and like the psychological, you relate, Leslie, right? Like, yes. Oh, am I crazy? Am I crazy? But like, no, I'm not. My son is in the ICU. Like something is wrong here. He was a totally normal, healthy kiddo. We move into a new home and I was questioning it. And then, to this day, his pulmonologist, which we've been discharged from because he doesn't have asthma anymore, says that I was wrong. No, it was just, he just outgrew it.
No, please tell me it's not true.
Yes, to this day.
I can't.
Yeah, I'm like, because the first winter we saw him for a follow-up, I was like, we had it all remediated and we haven't needed any of his inhalers. He's like, well, he outgrew it. No, we had radical mold remediation. Like it. So I guess my message to anyone watching is it's worth looking into because of the high percentage of asthma cases actually being mold toxicity. So it's still important, not saying don't stop taking your inhalers because we need to, like this title of this video is a downstream effect. We still need to care for the downstream symptoms and symptom management often is needed. But in the meantime, look upstream. Where is this coming from is my big message to people.
Okay. I love that. Let's see. We got some questions here. Okay. So someone is asking the name of the physician resource. And let me put that back up. This is the resource that I found very, very helpful. It's a website called survivingmold.com. And the founder of this organization is Dr. Richie Shoemaker, MD, and he's wonderful. I don't know if he's still seeing patients directly. I think not. That being said, I believe his mission, his professional mission is to train other practitioners because there is such an incredible problem. Such need. And the other thing that I don't know if this is worth mentioning, or even kind of dipping our toe in, Katie, is the relationship with Lyme. Should we go there, or is that opening Pandora's box?
No, yeah, we can talk about that too. Okay. One thing I was going to say about Dr. Shoemaker is he's I don't believe accepting new patients, but like you said, he still runs this organization, Surviving Mold, and he is speaking publicly. And I'm hoping to go in May.
Where is it going to be? I'd love
in Texas.
Okay.
I don't know if it's Dallas or Austin, but there's a SIRS convention. Him and a ton of top mold-literate doctors are putting on this convention, and I'm hoping to become a CERS proficiency partner in going to this conference where you can basically say you have a mastery understanding of CERS. So so he's still very much out in the mold world and community. So yeah, he's wonderful, like Leslie said. And then a person had asked the resources. Another really good resource I'll say is Jill Krista's website. She also has a mold physician finder where you can filter it by zip code.
Can you spell her last name?
Oh, sure. So Jill, and then last name Krista is Crista.
Okay.
I believe her website is jillkrista.com. I've taken her course. It's fabulous. It's for providers.
Okay.
And she has a whole other resource of certified mold practitioners where you can put in, like I said, the zip code and then filter to see who's in your area.
Okay. All right. So I put that website up as well. So probably between the two, I think you'll be in pretty good shape. So just give us a little bit of a hint as to the connection with Lyme, because I know there's a lot of overlap, right? Mm-hmm. So tell us about that, because Lyme is another really difficult situation to deal with. The manifestations can be actually very, very similar, even though kind of that root cause is different.
So with Lyme, right, it's usually, what's the word I'm looking for? Vector-borne, meaning you're bitten by something. Mm-hmm. Borrelia, Bartonella, Babesia, I believe is how you say it. So those little critters, if you get a bite. Now, people always think tick, and that's where, you get the Borrelia, I believe is how you say it. And then if it's acute and you present, with the standard bullseye rash, right, and the fever, then a Western medicine doctor will give you, I believe is it doxycycline, an antibiotic to treat it. And that's what should happen. I'm on board with the traditional. Yes, you should have an antibiotic because of the cardiac manifestations and a lot of serious things that can happen from untreated acute infection from Lyme. However, there is this, and this is not super well recognized in Western medicine world by everyone, but that you can have chronic or dormant Lyme. And so you get the antibiotic treatment, right, but you still feel like garbage. And this is sadly what happens to people is they get diagnosed with Lyme, or maybe they don't actually get diagnosed and it gets written off as, oh, you're fine. You just have a rash. And these people are limping along. They're fatigued. They're in pain. There's a whole slew of symptoms that a person with chronic Lyme, which is a slang term, but for all intents and purposes today, chronic Lyme, and they don't feel good. And then you throw in mold, because we know how chronic mold is, or how prevalent I meant. Then now your immune system has another tank to it. And that is a very, so it makes it harder for the body to release those like dormant infections. And then Babesia, I believe, is parasitic. So I actually have a really good anti-parasitic blog on my website too that cites a lot of evidence-based information about that. That if you have parasites, that's another, hit to the body for it having a hard time healing, because parasites, right, they're to some extent, somewhat normal, right? We have critters crawling all over us, but when it's overgrown, right, and they're using you as a host and they're draining you, they're depleting you of nutrients. Again, that's another hit that makes it harder. So I have a stepwise what I do in terms of, obviously not medical evaluation or management, but medical nutrition therapy, the stepwise fashion that I will go in helping people who have been acknowledged that they have chronic Lyme, mold, sometimes throw parasites in there, the order of operations that you should start to deal with those things, because you are correct, Leslie, that is actually really common. You will see people have a Lyme diagnosis on their chart or suspect Lyme, and they also are living in mold. And all of these things don't really get well diagnosed or handled in conventional care. So these people are desperate, and you can't blame them. I was desperate. I was passed around for years. So of course they're going to Google. Of course they're going to be looking, and I don't fault people for that. I actually tell my patients, if anyone ever says to you, don't Google, don't confuse your Google search with my medical degree, bless and release on to the next one, because if they're not helping you, it's on them. You don't feel good. You have every right to keep looking for answers, and as you should. That's another thorn in my side. I say with love, out of patient advocacy that your body's never wrong. Symptoms mean something. Keep digging. And if you find something that plants a seed that you can run with, and then eventually get to a practitioner who's going to hear you and listen to you, all the more power to you. Because I truly believe, had I not fought in like Mama Bear, my son would not be here today.
Mm-hmm.
And so I hate to say it, but you sometimes have to take matters into your own hands in this day and age.
Oof.
Not that physicians mean malice. Everyone goes into it.
Well, I think, they do.
Hands are tied to systems and care algorithms and standards of care. And we live in a very litigious world. So
yeah,
a lot of times people, they're going to go very by the book. And the reality is, by the book doesn't always get people better.
No.
You got to think outside the box sometimes.
No. And just incidentally, there are quite a few resources about Lyme as well on the Surviving Mold website. Mm-hmm. So, and there's a tremendous amount of overlap, right? Obviously the treatment is different, but some of the manifestations are very, very similar. So, so do be aware of that. Let's see. So let me just put a couple more questions up. Okay, so this person says, I have a patient with fatigue and now being treated for migraine. I'm interested in suggesting they get tested for mold. Okay, so what would you suggest, Katie? Because getting tested for mold, big topic, right? Where would one start?
Where does one start? It's a great question. So where do you even begin when you start to connect the dots? Because like you said earlier, Leslie, that aha moment of, oh my gosh, is this mold? Yeah. So it's highly debated. Do you look at the environment first or your body? Obviously, as a practitioner, I'm not a mold inspector. I can't test their home. I will give them resources, or a lot of people take my course online, and I've got a lot of information in there on how to hire a quality mold inspector, what is the credible databases to search for a mold inspector in. So you can simultaneously do it, right? Start looking into the home, because obviously if it's in the home, you're going to have to do that anyways. But some people, especially what I call the denial moldies, when they're like, nah, I don't think it's in my home. If we get some objective blood work or urine test, we got to go digging now. I tell them, I recommend, I'm never going to, point a finger or anything like that, but I will highly suggest, I would recommend looking in your environment. So if you, as a practitioner, if you're asking this question, you could order them a urine mycotoxin test. There are pros and cons of mycotoxin testing versus serum mycotoxin antibody testing. All of that stuff gets heavily debated back and forth. But my big message is something is better than nothing, to at least get some data to see what mycotoxins are in your body. If they're in your body, there is zero safe amount of them. We need to get them out. And then we need to figure out, drain the tub and shut off the faucet. Where the heck is it coming from? Is it school? Is it home? Most of the time it's home. I guess to answer your question, and I see patients all over the country. If you want to send them my way, if you're not sure what to do, I can do the testing, but you can get familiar with Rupa Health. Rupa Health has a lot of really great resources if you want to start looking into that yourself and ordering urine testing, or registering with my Myco Lab and starting to order serum antibody testing. And then of course you could always send them to a doctor for medical evaluation as well. And I do always think that should be happening. I'm not saying I'm out here practicing medicine, but the sad reality is finding a physician literate doctor. So then I would go back to those two resources of Dr. Krista or Dr. Shoemaker and see if they can find a physician.
Okay.
That was a mouthful. I'm sorry.
Yeah. Those doctors that are very mold literate are far and few between for the most part. I know there are more nowadays, which is really good. But I got to tell you, when I was in Illinois, I think there was one. That's it. And since he has moved on. So
you're correct. There's no SIRS doctors in Illinois. There's a couple in Wisconsin. I was actually looking into one in Hawaii when this all first hit me. But then I got seen by one in Milwaukee. But they're there. I mean, and that's all they really do, right? So yeah, you can get in. It wasn't a crazy long wait list or anything.
Okay, good. Yeah. So again, guys, if you're struggling with this problem, or you have patients that need resources, survivingmold.com is the one I'm familiar with, and it was extremely helpful. And Dr. Shoemaker does have a list of certified medical practitioners on his website. So you should be in good shape there. There's also Jill Krista and that's JILLKRISTA.com. I'm not personally familiar with her, but Katie is, so that could be a great resource. And then there's Katie. So, send them on over to Katie. How can people listening today, get in touch with you? Oh, it looks like we have another question.
Totally agree. The antihistamines, if they can't, it always gets labeled as seasonal allergies. And not saying those aren't real, but why is there a ding in the histamine bucket in the first place? Because histamine's a normal response to a foreign invader. But if you're chronically having all this histamine intolerance, mold is a huge one. H. pylori is a huge one. Gut dysbiosis from the mold. You have to take out the red flags and the barriers. And then a lot of people then don't need antihistamines, which in my opinion is often a band-aid to a deeper problem like mold. Some people, yes, and not saying allergies and seasonal allergies aren't always real, but oftentimes, again, it's that downstream symptom of a much more deeply rooted problem. So I agree. Antihistamine
tip off.
That could be just
antihistamine every single day. And that
was my son. He was on them chronically because he was covered in eczema and hives, and everyone just kept saying topical steroids. And I'm like, no, this 2-year-old can't be coated in steroids every single day. That's horrible. His eczema is completely gone, off all inhalers. He also was diagnosed with SIBO, diarrhea every day for years. It's all gone. All of it's gone.
Oh,
there's always hope when you can get to the root cause.
In your home, right? So there you have it. I mean, to me, that can really give people a sense of hope. Right?
Always hope.
Gotta get it cleaned up, though, guys.
Yeah.
I think, to me, that is the biggest, most important thing. It is your first line of treatment. You can throw all kinds of supplements and this, that, and the other thing, diet protocols, but it's probably not going to do a whole heck of a lot. It's just going to be a little Band-Aid for a while, but you're not healing the root. So the root is you got to get into a clean environment, even if you sleep outside, right? I was ready for it. It's like, I can do this. Luckily, I didn't have to resort to that, but
I've legitimately had patients sleep outside while there's mold remediation going on, but I have a whole part in my course too, where I talk about hiring a public adjuster who works for you, not for the insurance company. And sometimes we can get it, they're put up in hotels during this. So there is sometimes a way to get out while you are going through the remediation. But if insurance isn't covering it, yep, I'm outside. I'm out in a tent. I'm just like you, Leslie. I don't want to breathe any more of that in.
No. I mean, it was crazy. So, all right, I'm looking on Insta. We got a couple more questions. Are you okay?
Oh, sure.
I gotta check. Hang on. I gotta actually check my calendar. But while we do that, we have a question. Can the test show mycotoxins from a prior exposure?
Great question. So this is where, if you go in Facebook groups, you're going to see heavy debating back and forth between urine mycotoxin versus antibody testing versus SIRS testing, and everyone has very strong opinions. Urine testing does not distinguish current exposure. It just tells us what's coming out. Could it be from 10 years ago? Absolutely. Because a lot of mycotoxins are fat soluble. They can get stored in the fat cells. And then obviously metabolic detoxification is always occurring to some extent, meaning your kidneys and liver are always working. But if you were really, exposed and had a lot, backed up and being stored in your body, absolutely it could still be trickling out in the urine years later. So you are correct. The urine testing does not confirm current exposure. Serum mycotoxin antibody testing does. It means you are actively being exposed if your body is making either IgE or IgG antibodies to the mycotoxin, which is different than mold testing. A lot of times patients go to their doctor, the doctor does a mold allergy panel and it comes back fine. And they're like, see ya, you don't have mold's not a problem. Okay, it's not an allergenic problem. Doesn't mean it's not a neurotoxic, hepatotoxic, carcinogenic. And again, that's where Western medicine kind of doesn't do the greatest at. They're great at screening for and diagnosing mold allergies. But to answer your question, the thing though with the urine testing is at least it does tell us mycotoxins are still an issue for you. You still need some sort of detoxification. And I would still check and rule out that it is not a current exposure, because if it is, like Leslie said, the person will likely never fully get better every attempt is going to be some sort of Band-Aid suppressing a symptom.
All right, guys. We got to wrap up. I realized I have a call right now, so
sorry, I'm super chatty.
It's been amazing. Thank you so very much. I cannot thank you enough. This is, kind of our passion project. More you than me these days, but boy, oh boy, is it an important one. So thank you so very much, Katie, for sharing your wisdom. And thank you to everyone who joined us today. I hope you got a ton of value. All right. So I'll look forward to seeing you all next week. All right. Bye for now.
Thank you. Bye-bye.
Bye.